Hello, everybody. This is me, Maha. I'm a pharmacist, and I'm currently a student in nanoscience and nanotechnology master degree. And I'll give you a short presentation about metal organoframeworks, design and synthesis for cancer therapy and diagnosis. Metal organoframeworks are a new generation of nanoporous crystalline hybrid materials. They consist of inorganic metal ions linked together by organic bridging ligands, which form a three-dimensional structure, a crystalline structure that behave like a single entity with a completely different physical-chemical properties. They are designed and synthesized from variety of inorganic metal ions and variety of organic linkers together through diverse methods and strategies to obtain versatile structures and diverse morphologies, composition sizes, and chemical properties that allow their use in different applications. Different synthesis techniques of MOF include solvothermal, ultrasonic electrochemical, microwave mechanochemical, ionothermal, microemulsion, dry gel conversion, spray drying, electrospinning, diffusion, solvent evaporation, or stirring with reflux, microfluid synthesis, surfactant assistance strategy. Different applications include gas storage and separation, magnets, catalysis, solar and fuel cells, energy conversion, storage, removal of harmful and toxic chemicals, metal corrosion inhibition, nonlinear optics, biomedical sensing, and drug delivery. A huge application field. What makes MOF excellent choice for drug delivery in cancer is high porosity and tunnable pore size, high surface area and pore volume, which gives them a large loading capacity. Tailor composition and structure that can be used to tailor chemical and physical property to make them stimuli responsive. There is a surface modification and multifunctionalization possibility through surface modification. Most of important is the biocompatibility and biodegradability, and comes after facile production at low costs. Targeted drug delivery in cancer cells. There are two types of targeted drug delivery in cancer cell. First is passive tumor targeting, and it relies on the defective vascularity of the fast-growing cancer cells, which result in impaired lymphatic drainage, and the cells the drug can accumulate in cancer cells by enhanced permeability and retention. After that, the accumulated drug can be released in response to one of the characteristics of cancer cell environments. On the other hand, active tumor targeting relies on overexpressed receptors in specific types of cancer, and this strategy depends on functionalizing the metal organic frameworks with a ligand that specifically binds to these receptors. For passive targeting to occur, nanocarriers should have long circulation time, and that's why the particle size should be less than 100. to avoid identification and destruction by the reticuloendothelial system. Also, they can be coated with polyethylene glycol to prevent the plasma protein absorption. The nanoparticle size should be greater than 10 nanometers to avoid renal filtration by the kidney. Then after enhanced permeability and retention will occur in cancer cells, the drug will be released as a response for stimuli inside the cancer cell, like enzyme, pH, radiation. For active targeting, we use ligand receptor mediated targeting, like folic acid, hyaluronic acid, transferrin receptors, integrin receptors, epidermal growth factor, and somatostatin receptors. All of them are overexpressed in different types of cancer cells. Also, it can be antibody-antigen mediated targeting. Some antigen are overexpressed in certain cancer cells. For example, prostate-specific membrane antigen is overexpressed in prostate cancer cells. And if we can actually functionalizing the MOF with antibody specific to this antigen, will allow targeting of the MOF directly to these types of cancer. Other targeting molecules, aptamers, which are short single-stranded oligonucleotide that binds to specific target molecules. For example, AS1411 aptamer is a DNA aptamer and it binds specifically to nucleon receptors for active targeting. Advantages of target drug therapy is increased treatment efficacy, controlled biodistribution, reduced dose, decreased toxic side effects, improve patients' compliance, and modulated pharmacokinetics. Ligand targeting in drug delivery, here is one example. The MOF is synthesized, functionalized with an aptamer loaded with silver nanoparticle and doxorubicin. The drug binds specifically to the receptors and enter specifically to cancer cells where it is degraded, and doxorubicin silver nanocomposite is released. Stimuli responsive MOFs for drug delivery in cancer can be pH responsive, magnetic responsive by external magnet, ion responsive, temperature, pressure, light, humidity, redox, H2S responsive, ATP responsive, competitive binding responsive, and liposome responsive, different huge type. Here is an example: methylene and ligand synthesizes the MOF, and the drug enters the cancer cell either by active or passive targeting, where different stimuli, ATP, pH, H2S, is used to release the drug. pH responsiveness occurs through different mechanisms. You can see it here. Here is MOF synthesized from zinc and 2-aminoterephthalate acid, IR-MOF3, loaded with doxorubicin, anti-cancer agent, and celecoxib, the anti-inflammatory agent. It will accumulate by enhanced permeability and retention, and then pH, the low acidic pH characteristic to cancer cell, because cancer cell metabolism produce lactic acid, which lowers the pH, and the acidic pH of cancer cell result in degradation of the MOF. while it is stable in our normal body pH, which is 7.4. Redox responsive. Here is a MOF formed from manganese and diethylglycolic acid, loaded with doxorubicin, coated with dopamine for stability, and polyethylene glycol for longer circulation time and to prevent plasma protein binding, adsorption of plasma protein. Then it is inside the cancer cell after accumulation through enhanced permeability and retention. It's released because of high glutathione levels, characteristic to certain cancer. Same with here, high glutathione stimulate the release of cancer drug. This is a multi-responsive MOF, which is formed from the MOF with quaternary ammonium stocks. They are used for capping carboxylate to pilararine 5 and loaded with drug. Rising calcium ion concentration will result in degradation of the pilararine and release of the drug. And acidic pH causes degradation of the MOF, release of the drug, and thermotherapy also will lead to degradation of the MOF and release of 5-fluorouracil. Different stimuli. Multifunctional for cancer therapeutic imaging. MOF is synthesized, loaded with anti-cancer agents. Here the MOF is synthesized from TCPP, tetrakis carboxyphenyl porphyrin. This linker is a photosynthesizing linker, and by photodynamic therapy, it leads to release of reactive oxygen species, which lead to necrosis and apoptosis of the cancer. Doxorubicin is anti-cancer agent. It is functionalized with DNA that is carrying at its end fluorescein as a fluorescence agent, so which can be used for fluorescent imaging, and it can be targeted through active targeting at the same time. Here is also a MOF formed around ferrous oxide ions, ferrous oxide that respond to magnetic resonance imaging, and it's loaded with doxorubicin anti-cancer agent, carbon dots, and functionalized with aptamers, and it will bind specifically to the cancer cell. Here's also this MOF is ferrous oxide respond to magnetic resonance, and also carbon dots used in fluorescence optical imaging, dual modality, as well as it's loaded with anti-cancer agent. This one is also, beside the anti-cancer agent, it is loaded with Prussian blue for fluorescent optical imaging, and also ferrous oxide ion, magnetic resonance, and it responds to photothermal therapy, and chemotherapy is included as well. This one is triple modality imaging. It is using fluorescence imaging, CT, MRI, biodegradable metal node, and a non-toxic metal and non-toxic linker will result in a good MOF for drug delivery. Thanks a lot.